Well, cancer patients and survivors are facing a grim reality this morning with new data showing they're foregoing vital medication and scans due to the cost of living. A report by Cancer Council Victoria reveals a more than 50% surge in referrals to financial counselling, with some families struggling to balance medical bills, mortgages and just everyday expenses. Cancer Council Victoria's Head of Strategy and Support, Danielle Spence, joins us live from Melbourne. Danielle, good morning to you. These are tough decisions, potentially devastating consequences. Just paint a picture of what this data is showing and what it looks like for patients and survivors right now.
We know that people report to us just how expensive it is to be diagnosed with cancer. So out-of-pocket costs can range from a few $100s to tens of thousands of dollars. We know there was a landmark study back in 2021 by Consumer Health Forum that showed on average people were out-of-pocket $5,000, with actually 1 in 4 being out-of-pocket $10,000. And in a country with universal health care, that's really concerning to us.
So is it the problem that a lot of those costs are up front, so you're out-of-pocket for a while? You can't recoup the money quickly enough from either Medicare or private health funds?
There's always upfront costs if you go particularly private, but it's really the cumulative effects of a cancer diagnosis. So you might be in the treatment system for 12 months, but you're also in the follow-up system for many years, and that might be through your GP. And we know in Australia only around 1 in 4 GPs will actually offer bulk billing services. So it's all those incidental costs that surround a diagnosis as well. Just things like hospital parking. It's about $50 to park in our major hospitals.
Which is crazy. It should be free anyway, which is a crazy set of circumstances. This is a lot of anguish and pressure on people at their most vulnerable time. Are you expecting that to get worse in the year ahead?
Absolutely. It was over a 50% increase last year. We think that will continue. We know that the cost of living crisis is pinching people in many ways, but particularly when we have serious illness. We see people having to dip into savings if they have them. We see people trying to access welfare and people taking out things like credit cards just to pay cancer bills. So that's really concerning for us.
All right, Danielle, well, it's an election year ahead. Maybe there'll be solutions there in budgets that may be on the way. Let's hope so. Thank you for joining us this morning.
Thank you, Michael.